My name is Karina, and I'm a health analyst, and I am located in Memphis, Tennessee. I'm here because I believe it's imperative we start the conversation about mental health and to equip people with the knowledge. I'd like to say thank you for being here, and thank you to Dream Launch for giving us this platform. Okay, so the next topic we're going to talk about is family. All of these questions are going to be centered around dealing in quarantine and the mental aspect of dealing with others. So people around the world, they're faced with managing their relationships in close confined spaces, whether it be with their children, their spouse. Dr. Williams, can you talk about how quarantine is affecting parenting and other family dynamics?
It's been at least for most of I'm doing I see basically some hybrid, so I'm still going into clinic and seeing patients while also doing some tele-psych work, working in community community clinics. A lot of patients, this has been uh, a good shift in a lot of ways, because one of the problems when you work in community clinics is lack of access. People, they want to come in for services but have difficulties with transportation, or you know, um, do they spend money, to get bus fare to come see me versus, some other pressing needs. So it's been great from the standpoint of being able to access people, where they are. Now, with the quarantine, most people are home, so it's easy to at least, you know, um, get them. Um, the the problem, at least what I'm hearing for the most part, is that a lot of our patient population that we see are essential workers. So some have difficulties with childcare, and those things which kind of impacts their ability with the as far as parenting. The other issue is the online learning component. A lot of parents are not well versed with regards to the online learning or the expectations around those things. Some of the patients I see, their lack of computer access. So, you know, this whole, going to virtual learning, yes, that may be great in a sense, but there are a lot of people that don't have computers at home, or, ability to access some of those things, So, um, and then of course, the relationship with the kids. A lot of times, the parents, especially kids that have behavioral problems, they're home a lot, so that kind of impacts the entire dynamics of the family. Usually, if you want to say school is a respite, um, parents have a little respite from the kids for a few hours, but now it's a little bit difficult, with regards to having to manage behaviors, but then at the same time trying to instill discipline, and also trying to homeschool and doing everything in what I call like confined spaces. The kids are having problems because they can't go out to play, and then when I, where I work in Baltimore and DC, it's a little difficult. You have community violence, so people generally don't want their kids going out to begin with, and so those are some of the things that sort of impacts, uh, um, relationships during this period right now.
Well, I think following up what Dr. Williams said, one of my biggest concerns is the reality of domestic violence, and also kids that are sexually abused. I mean, because we're also looking at the same way that these kids are home, a lot of the services that we rely on, such as child protective services, that's not fully functioning. So there's a significant amount of our population that's truly, truly at risk. And that's another thing that we need to really, really consider, and some of the downfalls of the actual quarantine. And also another thing too is, again, if you look at social media, there's often like a lot of jokes about people drinking. Like even like this, we call this the happy hour, but that within itself is giving some people indirectly, we actually may be celebrating substance abuse, celebrating alcohol abuse and all those kind of things. And we know that actually leads to domestic violence, that actually leads to sexual exploitation. So there's a lot of things that are going on at this point.
Can I add something real quick?
Sure.
One of the unique things about this time is it causes a challenge of how to be creative with problem solving within a family, because you're dealing with the need for everyone to be on a schedule so that the adults in the house can get done what they need to get done, because it's not unusual that one or multiple people in the house are working from home while they're still having to balance the educational needs of any young people in the house. So one of the things that's been humongous is as far as finding ways to put everyone on a schedule and then find creative ways to interact with each other so that you're able to turn this experience instead of it feeling like a traumatic experience where we were all stuck at home together, to a narrative where we were all at home together, but we learned some new things together. We did some things together. So finding creative activities to do together. I'd spoken with someone recently and they were actually doing guided meditations in the evening, the entire family, including the children, but finding ways to incorporate young people in the household with things going on. So it's not kind of the parents are in one area, the kids are off doing whatever on the internet somewhere else, that you're able to integrate and creatively do activities together, along with being creative about how to make sure children stay connected to similar aged peers, because as adults, it's very easy for us to FaceTime or hop on a Zoom or something like that. And it's very easy to integrate that as adults, even though it may not necessarily feel totally natural, because that's not how we usually interacted. But making sure that your children still stay interactive with some same age children, because especially if they're not someone that plays video games and has on a headset that they talk to their friends all the time through the headset, it's very easy for them to become isolated unless that little bit of time where they're on Zoom with school, but kind of being creative with play dates and things or creative ways they can interact with peers, so that it's not a situation where all they're exposed to are adults and they feel like, I'm never going to see my friends again. I don't know when I'm going back to school. That's where all my friends were. And then they start feeling really sad or down or frustrated because they're stuck with all these grownups that they're tired of.
Thank you, Dr. Goodwin. Dr. O, welcome to the call. You're muted, but can you unmute and just introduce yourself and tell us a little bit about your work in psychiatry and mental health?
Thank you guys for having me, and I do apologize for my tardiness. But for the past 8 years, I've been practicing in Houston, Texas, and a part of the comprehensive psychiatric emergency program. And so our services are geared towards the indigent, and we service a significant homeless population. And this COVID-19 experience has been especially crippling for those patients who are already dealing with significant psychosocial issues, as we already know. Lack of employment, lack of safe shelter, limited access to food and other resources. And so I've been having a lot of my patients complain about, who are already having issues with transportation and getting an ID or a birth certificate, and different documents that are necessary to obtain housing. Those things are put on halt right now. And so they're, in addition to battling with their mental illnesses and substance abuse problems, they have an added stressor in their lives. So it's been really challenging trying to navigate that additional hurdle with our patient population. And some of them even have limited access to food because a lot of the shelters and facilities that would provide hot meals are no longer able to do that due to social distancing. The curfews here in Houston at midnight, if patients aren't in a secure place, they're being threatened with a 2-week quarantine and possibly losing a job if they have one, that type of thing. So it's been challenging, to say the least.
Okay, I'm gonna take the conversation back to the kids, because I feel like there's a lot of parents that are dealing with just 24/7 having your children and not really getting a break. So Dr. Goodwin, a lot of parents are noticing that their kids are sleeping all day, sleeping in, hiding emotions, and when they actually are able to communicate their emotions, it's normally outbursts. So they're not able to go to school, see their friends, or have any real physical, social interactions. How do we address those changes without adding to the pressure? And how can parents best support their children who are still adjusting to the norm?
Thanks for that question. The first thing I would say is that it's important to have your children on a schedule. There are a lot of reasons why schedules are extremely important. One reason is it makes the day predictable. And the thing that you want to be able to provide for these children is some sense of predictability and control instead of them having a narrative or feeling like things are totally out of control or uncertain. So by putting in a schedule, it helps them be predictable, and then you can put them on a schedule that also may mirror their school schedule. So one of the things I recommend is you look at the school schedule and you do lunch at home when they do lunch at school, snack, do the subjects around the same time, so that their routine hasn't changed dramatically. There's some changes that are going to be natural because they're home, but you can try to make things as predictable as possible. Having them on a schedule also, it helps them know what's coming up next. It also helps you plan things that you can do to keep them active and engaged, because the one thing you don't want to have is a situation where your children are, all they're doing is sitting on some random screen, taking in a lot of information that they can't process, because these days everything is connected to the internet. If we think just as adults, all the information we get between CNN, TV, what's on Twitter, what's on Instagram, that if you have a young person that they're just unbridled on the internet and it's not monitored, then they're going to have information overload even worse than an adult would. So the other thing I recommend is being very cognizant and monitoring children's screen time, what they're looking at, how long they're looking at it, and then being able to take breaks to have honest conversations with them that are age appropriate around what's going on. Be it if they're really young, you'll probably talk about germs, maybe viruses, but germs that nobody wants to catch. You know, if they're a little older, but asking them specifically what their feelings are and not just trying to guess their feelings. And then also doing things together as a family, because that also helps fill that time, because you don't want a situation where they're just bored because they're not doing what they usually do. But this is a time you can cook together, you can meditate together, you can color together, you can put them in touch with. One of the things I've seen people do too is when they're doing these virtual play dates, they're coloring, they're doing games. There are just all kinds of things they can do, but part of it is just actively engaging the children and then realizing they have emotions. We're adults. Everyone is having a shared global collective experience. Everyone may not react to it the same. So the first thing is, if you have children, knowing you can have 3 or 4 different kids that are all dealing with this differently. They all have different feelings, and having their space for them to have feelings, but to actually talk to them about it instead of just either assuming, or if they're playing fine, assuming they're fine, is to honestly just ask them, how are you feeling? How are you doing? Are you scared of anything? Looking at how they're sleeping. Are they not sleeping or sleeping too much? Are they complaining of nightmares? So that you can have these conversations around what their fears are. And then if it gets too bad, then you have an idea that you may need to talk to a therapist or talk to someone just to get a little bit of extra help.
While we hope that hearing about mental health can be therapeutic and helpful, it is not a replacement for medical attention. At the end of the video, you will find a list of resources for mental health and anyone seeking professional care.